Greetings, MHW family. I'm recording this because I recently had news about the death of Tito Jackson. He's many of you may know he's one of the members of the Jackson Five family. We all know about Michael Jackson, and those of you who may have grown up in my era knew about the Jackson Five. These guys were fantastic performers, and of course Tito was the one who wore the hat and he also played the guitar. I think Jermaine played the guitar as well. And I was in Atlanta with my middle daughter, and we were in a Fox News studio, and we heard of the death of Tito Jackson. Now, I read some reports on this, and there was a news report that showed he had a heart attack, or it expressed he had a heart attack. Now, there are lots of news reports saying that his form of death hadn't been confirmed, but I did another video that you'll probably see online, and I went live on that one. And I go through that news article, and based on the reports of his um, friends who were with him, I'm pretty sure he had a heart attack. What I want to talk about you now, the high risk for heart attack, and the three conditions you need to know about to determine whether you are at risk for heart attack. So I want to share that information with you now because it's important to understand that heart attack is among the top killers. Heart disease in general is the number one killer of men and women in the United States. And heart attack is a leading driver of conditions of heart disease, such as heart failure or coronary disease and an ischemic heart disease. And so collectively, these disorders contribute to the number one cause of death, which is heart disease overall. Many people walk around at high risk for heart attack and they don't know it. These are three conditions that you may have that will indicate your increased risk of having a heart attack. And I want you to stay to the end of this video, and I'm going to share with you information that you can take in terms of steps that you can take to decrease your risk for this condition. So let's take a look at the slides I've made here. Again, I made a few slides. They're not very long. What are these key conditions? These are broad conditions that are health related. The number one condition is a poor lifestyle. Many people have poor lifestyles. They don't realize it. First aspect of a poor lifestyle is that you have a sedentary activity level. That means you're exercising fewer than twice a week. You're walking fewer than maybe 5,000 steps a day. Your daily activity or work consists of sitting most of the time and sitting indoors in particular. The other aspect of a poor lifestyle is your diet. This is probably the number one aspect. Many of you hear me talk about diet a lot. And if your diet consists of you consuming one of more of the following food types more than once a week or at least once a week, such as processed foods, sandwich meat, snacks, fast foods, grilled, fried, and microwave animal products, processed dairy foods, sugary beverages. If you're consuming these foods at least once a week or on a regular basis, this is going to put you at risk for a poor lifestyle category, which is one of the three categories of increased risk of a heart attack. How about abnormal health findings? Well, there's certain health findings such as blood pressure. If your blood pressure is consistently greater than 140/85, that's a significant heart risk. If your BMI is greater than 30, if you have a total cholesterol that's greater than 200, or if you have a hemoglobin A1C is 5.7 or greater. If you have about at least two of these conditions, you're going to be have the abnormal health findings category, which again puts you at increased risk of a heart attack. Any one of these conditions puts you at risk for a heart attack. The more of these conditions you have, the greater the likelihood that you're at increased risk of a heart attack. Key physical symptoms such as chest discomfort. It's not always a pain. It could be a discomfort. It could be a tightness, a fullness, a pressure. It could be a grabbing-like sensation. Sometimes people feel a sticking-like sensation. It doesn't have to be in the chest. It can be in the chest, the left, center, or right, but it can also be on the shoulders, the forearm, the neck. Can be a grabbing of the neck or in the jaw. So chest discomfort in this area could be a sign if you have heart disease and maybe an increased risk of a heart attack. Also, shortness of breath. That is a sign that your heart's not pumping normally. So this could be shortness of breath when you say climb stairs or exert yourself, or you get shortness of breath. Excuse me, shortness of breath when you are, walking or talking. These are symptoms of can be symptoms of heart disease and may put you at increased risk of a heart attack. Fatigue is another symptom that you may have. Again, a sign or symptom associated with poor heart function, possibly due to heart disease, and sudden onset of cold sweats. This often happens at night. People say, I'll wake up in a cold sweat. And this is often a sign of high adrenaline. This can be associated with arteries spasming. And if you look at my video when I talk about Tito Jackson's symptoms, you'll notice that he had cold sweats. So what can you do about it if you have these conditions? Let's say you have a poor lifestyle or you have some of these abnormal signs or symptoms. Here's some key steps you should take. I think you should take immediately. First, try to get an appointment with a doctor within 2 to 3 weeks, preferably a cardiologist. But if you can't see a cardiologist first, at least see your primary care physician. So you should have these things checked out. You want to let them know that you're concerned about your heart because oftentimes you'll see the doctor and you'll give them the signs and symptoms. They may not immediately cut to the chase. So let them know, look, I'm really concerned about my heart. I'm having these symptoms, these signs. I have a sedentary lifestyle. And so they may order some critical tests to get the evaluation done sooner. The next thing you should do is change your lifestyle immediately. You should immediately start consuming a diet with unprocessed plant foods. Many of you know what that means, greens, beans, grains. You can also consider a nutritional detox diet. I left a link below in the description. We have a 2 detox regimen that you can follow. One is a jump start, one is a more extensive rebuild course. These tell you how to clean up your diet in a rapid way that will help you out. And of course, last but not least, mildly increase your activity level. So if you're a couch potato, get up and walk slowly. If you are already walking, then you can maybe walk more briskly, walk along a distance. Just increase your activity, but get away from the lifestyle of sitting around. There's some blood tests you can order. Let's say you can't get into your doctor's office right away. Many people live in places where if you're in a big city, you may have any lab test now close by. And these are the tests I'd recommend. You can get lab tests ordered from any lab test now. There may be some other independent lab tests we can order without a doctor's order, but get a complete blood metabolic panel, a standard lipid panel, a complete blood count, a hemoglobin A1C. These are some key blood tests. You may call your physician and ask them, what tests, if they'd be willing to order these tests before you have this information for you. So I think this is important information for you to know. I like to use news of, say, a celebrity dying or event. People are doing a search, try to bring some helpful information to the general public, and hopefully this will be helpful to you. If you're new to the channel, please subscribe, and of course give us a thumbs up, like this video, and please share this with as many people as you can, because I think this will be very helpful to not only yourself if you have some of these risk factor conditions, but many friends and loved ones. Until next time, take care.